Just like a lot of my healthcare worker friends, I knew that going in to take care of an overwhelming number of coronavirus patients, I could potentially get infected. I was exhausted. I had muscle aches, I had a headache, and by the next day I developed a cough. And then I started losing taste.
Dry cough, headache, weakness, low-grade fever. So I did the test, the results came back, I was positive.
And I found out that I was positive for the coronavirus. I had friends that had to go to the hospital. And there's nothing scarier watching your friends get sicker and you're sitting there waiting to find out if that's going to be you too. I will say that taking care of patients who were symptomatic of coronavirus, while I was symptomatic for coronavirus, and then after I found that I had it, was actually a gift that I wasn't expecting for my ability to be a really compassionate and empathetic doctor. Once I found that I had it, I was able to say to them, look at me, I'm okay and you're going to be okay too.
I started to monitor my oxygen saturation and also my symptoms. And I was also able to track it with ultrasound, which turned to be a useful tool. And I was able to see how the disease affected my lungs. Now I'm using it with every single patient, and now I'm treating in my hospital.
By the time I was going back to work, New York City had changed. Before I went back into my first shift, I was petrified of the volume of disease and death and uncertainty.
Everything has changed a lot. We are seeing many co-workers, friends, colleagues, mates that have fallen into the disease. So in my emergency department, 60% of all the staff is now sick.
I think a lot of physicians have really processed their own mortality for the first time. Over the past week in New York City, we've seen a leveling off of new cases. We almost hit that level where we broke. We almost had the point where we ran out of ventilators.
After weeks of lockdown in Spain, the number of patients decreased rapidly. Many of the physicians, healthcare workers, we cried, we struggled, we faced the worst time of our lives. But don't lose hope.
People ask me all the time, how can we say thank you to healthcare workers? In New York City, we have this 7 p.m. musical applause where all these people go out their windows and say thank you. That's wonderful. We appreciate that. What we'd appreciate more is people not stressing our system by getting out of the house earlier than we can handle it. I know everyone's exhausted. I just need everyone to stay the course because what we've done is working, and it's working to save as many lives as was humanly possible in the face of this virus.